Charlottesville is in the thick of a resurgence of gun violence. Many shootings happening right down the road from UVA. Well, now the hospital network is getting a boost of more than $600,000 to help people heal physically and emotionally after being victims of violence. Avery Davis shares what the new violence intervention program means to the community.
Yeah, that's right, Aaron. With more people coming through its doors with gunshot wounds, UVA Health says this program is needed now more than ever before. And people living in the neighborhoods most impacted tell me they're looking forward to any sort of relief from this public health crisis.
It's time to make it happen because I don't want bullets to hit my house. I don't want bullets to hit my car. And that's what has been seen. I've seen bullets flying.
For Stacy Washington, a resident of the Fifeville neighborhood, those flying bullets have shattered more than bricks and windows.
My niece was a victim of the 4th of July shooting. There was another shooting directly behind my house. I was actually outside when it happened. It's very traumatizing to live somewhere where the gun violence is very, very, very high.
Less than a mile down the road from Washington's house is UVA Hospital.
So we were awarded a grant which basically will allow UVA to hire people to come into the hospital to help those who have been impacted by violence issues.
Brittany Nash is with UVA Health. Once the program is up and running, Nash says people who come into the hospital with gunshot wounds will be visited by a community member who will help their healing and reintegration process.
So that they can know that there's somebody in the hospital who is here rooting for them, but then also when they leave, helping them navigate managing living life after having this traumatic experience.
I think it would be beneficial to the whole community. This is what we needed because we feel like UVA can fund all the organizations.
Brian Page is with the Central Virginia Violence Interrupters. He says this program is no silver bullet, but at least it's a step forward, helping to heal both the physical wounds of violence and the emotional scars that perpetuate it.
And a lot of the children that are committing these gun violence, they're coming from generational trauma. So that deals with the health component as well because they're not being properly treated.
Washington agrees a lot more work is needed, but it would have been nice to have this program around sooner.
My niece has not wanted for anything. But UVA probably would have been wonderful to have those resources.
UVA tells me the most important aspect of this program is that it will be relying on people already at the heart of this crisis, activists and neighbors, instead of white lab coats. Live in the studio, Avery Davis, 29 News at 5.